Hello and welcome to Comcast Local Edition. I'm Robert Traynham. Joining me here in Annapolis is Delegate Bromwell, who represents District 8. Delegate, welcome.
Thank you.
Let's talk about the budget. That is first and foremost on people's minds right about now. You have families sitting around the kitchen table cutting back on what they can and cannot do. And you also have the federal government telling states, we're looking at our budget and saying, you know what, through this economic stimulus package, we can do X, Y, and Z. But you know what, states, you have to do A, B, and C. How do you do less with more?
Well, you have to look at ways to generate revenue, and you also have to look at ways to cut spending, unnecessary spending. This is my 7th year in Annapolis. I've avoided voting for major tax increases and major fee increases. It's something that I'm proud of, but I've also looked at ways to raise revenue. I've had a bill which served as an amendment in the past, but I have a bill that would put slots at BWI within the terminals. I think it's as low an impact as you can get. You have to have a ticket to get on a plane, or you have to be landing to play. We have to raise revenue. People don't want their taxes and fees raised, and that's what we're going to keep doing. And
how do you prioritize when everything is a priority? When you have disease groups, education groups, healthcare groups, I mean, you name them. Every advocacy group is saying we have to do more with less. And if, in fact, you do cut our budget, in other words, our allocation from the state, we're going to have to turn away some folks. How do you prioritize?
You go line by line. I'm a member of the Health and Government Operations Committee, so most of my time is spent trying to increase access to quality and affordable health care and prescription drugs, and we're going to keep doing that. But at the same time, you have to go line by line, see where you can take a little bit, cut a little bit here, cut a little bit there, and that's really what my district expects me to do.
Let's talk a few moments about the death penalty. It's my understanding that you have some work in the process to deal with this issue.
Sure. I'm against repealing the death penalty. One thing that people often overlook is our officers that are protecting our prisons. You know, when you have the worst of criminals sitting in prison for the rest of their lives, it really puts those officers, correctional officers, in danger. And in the governor's budget, there's an increased workload on those correctional officers. So we're telling them we're going to increase your workload, and then you have some people that are calling to repeal the death penalty. And it really puts them in a lot of danger. I also think that you have to have a top punishment. You have to deter criminals. And I think that, you know, if someone is thinking about committing the most heinous of crimes, you have to deter that, and I think the death penalty is a deterrent.
You do believe that, because there are some studies out there that says that the death penalty is not a deterrent for
they've studied this issue every year for the past 15 years down here, and most of Maryland is in favor of the death penalty. Most people in my district, I believe, are in favor of the death penalty, and I'm going to vote the way that my district wants me to.
You had mentioned a few moments ago that you are in a health care committee, and it's also my understanding that health care is near and dear to your heart. What are you working on?
We're working on ways to get doctors money. Basically, you have some insurance companies that are withholding money. They're not paying doctors. We're losing doctors. We're losing nurses. We live in what I would consider the hub of excellent health care in Maryland, in the world. So I think that we have to make sure that people are getting paid for their services. We have to make sure that patients are getting the proper care. And there's, you know, if health insurance companies aren't willing to pay, if, you know, for instance, if somebody doesn't dot every I and cross every T, they're withholding money, and I think it's wrong. That's one thing that we're working on.
Yeah, it's fascinating to hear, because I think most people out there, particularly in Maryland, would say, you know what, maybe nurses may need to be paid a little bit more, but doctors, probably they're overpaid. But you're saying that some doctors in the state of Maryland are underpaid.
Some are underpaid, and then you also have circumstances where they're just not getting the money that they're owed. And I want to make sure that we keep excellent care in Maryland. It's very important to me, and I also want to make sure that we expand coverage to people who don't have it, people that should be able to afford it but possibly can't. Healthcare costs are way too high. We have to bring those down.
Very quickly, how can folks get a hold of you?
I'm very accessible. You can look me up anywhere on the internet. I have a home office in Perry Hall where I live. If you can't find me, I'd be surprised.
All right, thank you very much.
Thank you.
All right, to find out what Comcast is doing in your community, click on the On Demand button and then get local. Have a good one, everyone. Take care.